My name is Richard Blake, and I have one basic question, and that is, I understand that we have approximately 47 million people in this country without health insurance. I also understand that out of that 47 million, that approximately 40% of those are illegal aliens. Now, just bear with me. I also understand that approximately 30% of those are making more than $53,000. I also understand that of that 47 million, 20% of those are eligible for Medicare and have not even applied. So that leaves 10%. And that's 4.7 million. I'm asking you, Congressman, how can you support that and put our country trillions of dollars in debt for that, when our real problem is jobs, the economy?
Thank you for making the connection between our economy and economic health and our healthcare system. With regard to the 47 to 50 million American citizens who don't have insurance coverage, 2/3 of them are working families that can't afford the high cost of insurance coverage. 27 million are employed in small businesses. Now, small businesses provide 8 out of 10 of the new jobs in America. 93 out of 100 employers in this country are small businesses. They're responsible for over 50% of our nation's GDP. They're an economic engine. And our small businesses are having trouble covering their employees because of the sky-high cost of insurance coverage. So for the small business owners that are here in this room and might be listening, the greatest gift coming to you is healthcare legislation that will put you together in a large purchasing pool. I want every small business to be treated like a large business. If, for example, the study from Minnesota revealed that small business owners are paying anywhere from 18% to 60% more for health insurance premiums than a large business. And that's because of the purchasing power of a company, a corporation that's multi-state that might have 10,000 employees. They can drive down the cost. I want small businesses to get together into buying groups that are very large within regional markets and leverage down the price of insurance coverage. That will help make it more affordable so they can then choose to cover their current employees. I disagree with your numbers with regard to the data on the 47 to 50 million people who are citizens who don't have coverage. The numbers that I'm familiar with, that the experts are presenting to Congress in their testimony, don't reflect the illegal component. But I think
you're saying out of the 47 million, there are no illegals in that number.
That number does not include people here outside the law. And there are anywhere,
probably respect.
I'd be happy to take a look at the information you have and we can compare numbers. I think that's a number issue. We can look at that and find out what's really real.
Pretty critical, but we still haven't addressed the issue of jobs. That's the problem here. That's the problem. And we're going to be spending trillions of dollars on, I think, a secondary issue. These people need jobs.
Well, if small business provides 8 out of 10 new jobs, and if you're an owner of a small business and lower your overhead by decreasing the insurance premium cost by 22%, you've got more money in your bank account now to invest in your business, to expand and hire more people. So think of the healthcare reform legislation as a job stimulus, because that's what it's going to be. When the cost of care goes down for every city government, for every business, whether it's large or small, there'll be more money available to invest in their business and expand and create jobs.
The administration right now is now saying that they're going to increase taxes for the middle class.
That's right.
That's just not true.
The Secretary of the Treasury said that.
That's just not true.
I live in Minocqua, and like Don, I currently sit on the town board. No matter what way you shape this up or toss around, this is socialized medicine. few million people. It's for the veterans. And that doesn't work. How are we to believe that you're going to be able to take care of 300 million people with socialized medicine?
Well, thank you, John, for your comments. I totally disagree with you about the socialized aspect of this, because it's private doctors. I have some experience being in the VA as a doctor. I worked in the VA hospital in Middleton, William S. Middleton VA Medical Center, 1973. I worked in Lakeside VA in Chicago as an intern. I worked in Zablocki over at the VA in Milwaukee. I have some experience personally with the VA, and it has gotten dramatically better since the 1970s. It is tremendously better. You can now get the same services in the VA in Zablocki that you get at the Medical College of Wisconsin. The same surgeons, the same doctors, and the quality of care at the VA has skyrocketed. In the last 3 years, the Congress I have the honor of serving in increased by a greater amount than ever before in American VA history the amount of money going into medical care at every VA, and doctors, and employing people to take care of our veterans. So I would dispute your claim about the VA. Its quality of care is getting better and better every day. I think if you're referring to socialized medicine, are you referring to Medicare?
That it doesn't work. It doesn't work well. What makes you think you're going to be able to make it work?
Well, I've never said that I can make that system work. It doesn't work in Canada, as you said, because every province runs out of money in the end of November. And they have a two-tiered system in Britain. They have a two-tiered system in Germany. And we're going to end up with a three-tiered system. We're going to end up with the VA military health care system. We're going to end up with government-sponsored programs, whether you call it Medicare, Medicaid, or another name, and you're going to have a private system. So I think in the end, what America is ready for is a uniquely American solution, and that'll be a three-tiered system. That's a big one. It's private hospitals that care for Medicare patients. It's private for-profit drug companies that provide for their prescription drugs. It's private doctors that provide the care. I don't work for the government, and I want our doctors to work for you. And let me just make this point abundantly clear. I don't want anyone's doctor to be working for anyone but the patient. I don't want the doctor to work for a hospital administrator. I don't want the doctor to work for an insurance company or a government agency. In my view, you get the best care when your doctor is working for you.